pressure of the gases. In considering this, we can apply Dalton's law to atmospheric pressure. The atmospheric pressure, which is equal to 760 millimeters of mercury at sea level, is equal to the sum of partial pressure of the gases that are found in the atmosphere, such as nitrogen, oxygen, carbon dioxide, and water vapor. In the atmosphere, regardless of altitude, the proportion of oxygen, nitrogen, and carbon dioxide vary. Nitrogen has a partial pressure of 79%, oxygen has a partial pressure of 21%, carbon dioxide has a partial pressure of 0.04%, and water vapor has a partial pressure of 0.5%. Therefore, in calculating this, we can see that the partial pressure of oxygen at sea level is 160 millimeters of mercury. Looking at the equation below, we can see that the sum of partial pressures of each of the gases equals 760 millimeters of mercury at sea level. However, at Everest Base Camp, which is found at a higher altitude than sea level, the total atmospheric pressure is 400 millimeters of mercury, which is lower compared to 760 millimeters of mercury at sea level. Therefore, in determining the partial pressure of oxygen at altitude, we find 21% of 400 millimeters of mercury, indicating that the partial pressure of oxygen at Everest Base Camp is 84 millimeters of mercury. So in summary, the partial pressure of oxygen at Everest Base Camp will be lower than the partial pressure of oxygen at sea level, as a result below atmospheric pressure at higher altitude. In terms of what happens to ventilation at high altitude, let us first consider what happens to the arterial partial pressure of oxygen. Since the partial pressure of atmospheric oxygen at Everest Base Camp is around 84 millimeters of mercury, this means there will be less oxygen entering the alveoli of the lungs. At the alveoli capillary junction, there will be a reduced amount of oxygen moving from the alveoli into the capillaries, subsequently reducing arterial partial pressure of oxygen to around 28 millimeters of mercury. Hemoglobin is important for the delivery of oxygen to tissues due to the fact that at high altitude there is less oxygen entering the blood. The saturation of hemoglobin with oxygen will decrease. However, over time there will be compensatory increases in hemoglobin and hemoglobin delivery of oxygen due to the production of erythropoietin at high altitude, which increases red blood cell and hemoglobin production to improve oxygen delivery. When low partial pressure of oxygen is detected by central chemoreceptors in the medulla, efferent impulses are sent to the respiratory muscles such as the diaphragm to increase the rate of ventilation and respiratory rate. This attempts to increase oxygen uptake through increased ventilation and thus corrects oxygen levels. High altitude pulmonary edema, HAPE, is developed in lowlanders who rapidly ascend and are exposed to altitudes that are greater than 2,500 meters. It is an advanced form of altitude sickness which causes an abnormal buildup of fluid in the lungs. This buildup of fluid can be very fatal. Barometric pressure decreases as altitude increases. Despite the fact that oxygen in the atmosphere remains constant, the overall amount of oxygen that is available in the atmosphere is less at high altitudes compared to sea level. Hence, this results in a net reduction of blood oxygenation. The lower levels of blood oxygenation causes hypoxia to occur, and small pulmonary arteries will constrict. As arteries in the lungs narrow, the absence of oxygen in the blood reduces blood flow through the lungs. This causes pulmonary blood pressure to heighten. The fluid is pushed into the alveoli in the lungs as the pressure in these blood vessels arise. Alveola is filled with excess amounts of fluid that is leaked out of the blood vessels in the lungs instead of the air. Normal oxygen movement is reduced through the lungs because of this excess fluid, which leads to impaired gas exchange, difficulty breathing, and low levels of blood oxygenation. Overall, so when blood pressure rises, water enters the lungs, which further decreases oxygen content in the blood. If left untreated, HAPE can progress rapidly and often be fatal. Some signs and symptoms of HAPE include headaches, which is usually the first symptom of HAPE, coughing, chest discomfort,
discomfort, breathlessness at rest, tachycardia, which is rapid heart rate, crackle of the lungs, and many more have been listed in the slide. Immediate enhancement of oxygen by rapid descent is the most effective treatment for HAPE. The administration of oxygen is not just used because the mountaineer is low on oxygen, but rather uses oxygen as a potent dilator of the pulmonary arteries. This allows blood flow into the lungs and increases the ability for gas exchange to occur. Additionally, some drugs such as Diamox and nifepridine are effective in preventing and reducing the signs and symptoms of HAPE. Diamox is used to reduce headaches, tiredness, nausea, dizziness, and shortness of breath, and nifepridine helps to dilate and open up the blood vessels in the lungs. This reduces the high pressure in the vessels that force the fluid out into the pulmonary system. The take-home message is that medication treatment is always only a temporary measure. Descending is the best and most effective treatment for HAPE.